The miracle that is organ donation. We'd like to welcome back Dr. Jared White, Surgical Director of the Living Donor Program at MUSC. It's good to see you again.
It's great to be here, Leyla.
How have things been during the pandemic? Because, getting organ donation, finding donors, it's a bit of a challenge in and of itself. And then you add a pandemic on top of that. I can only imagine how much more challenging that would be.
Yeah, the pandemic brought a lot of challenges that we didn't necessarily anticipate. And of course, nationwide, a lot of surgery departments had to put off non-emergent cases, but transplant was one of the surgeries that was deemed as still an urgent surgery given the life-saving capability. So we actually transplanted and were as busy as we had ever been this past year. But organ donation did take quite a hit throughout the nation due to the being careful not to utilize COVID positive donors, for example, because we wouldn't be sure how exactly the recipients would do with immunosuppression if they received an organ from a COVID positive patient. So it did bring quite a few challenges for not only our program, but all programs nationwide.
I'm curious to learn more about the immunosuppression, and also just have we learned anything more since then about viral transmission, that if someone either has antibodies of COVID, does that get passed on to the recipient?
Well, it's a great question. I'm not sure I have all the answers on that, and some of the data may be out. We know we've successfully transplanted several liver recipients, for example, that were previously positive for COVID but had a long enough duration after their symptoms resolved to where they had antibodies but no longer tested positive for COVID, and those patients did well. We have seen probably the biggest challenge with our kidney transplant recipients, where if they got a transplant and then were infected with COVID sometime post-operatively, we actually had a lot of fatalities from that. So it's something that we are vigilant about monitoring and screening for symptoms and testing, as you can imagine.
Absolutely. And I want to also get into vaccinations as well. But in those cases where you had a morbidity rate of people who had received organs, got sick, is there any more research being done on how to mitigate those deaths, on how to prevent deaths because of exposure to COVID?
Absolutely. I mean, there's extensive research going on, not only at our program, but really probably worldwide, I would say, but particularly nationwide, of just what infection with COVID, what the ongoing risk for patients with organ transplant and immunosuppression are. And like I said, that data is, I'm sure, ongoing, and perhaps over the next year we'll know more about it and where we stand.
What do we know about vaccinations? Because now we understand that vaccinations are going to soon be available for all adults in the United States. A lot of people have been vaccinated already. Does that impact donation, and does that impact the recipient should they receive an organ of someone who's been vaccinated? And furthermore, someone who, say, gets vaccinated post-operatively, how does that work?
Yeah, so we're trying to encourage all of our potential recipients to be vaccinated. If they can get vaccinated before their transplant, then we feel like that's going to at least help mitigate some of the risk post-operatively. We know that vaccines aren't perfect and does require some time interval for the body to make those antibodies that are necessary. Same thing applies for the donors. If you're going to be an organ donor, if you could be vaccinated for a time interval before donation, we think just risk of surgery in general. We know that any patient needing an emergent or a non-emergent surgery, if they can get the vaccine prior to their procedure, we think that's going to be beneficial in the long run should they get exposed or develop COVID in the postoperative setting. We at least feel like those risks might be mitigated.
Right. There's just so many things to talk about and unpack here, but I did want to get to one thing about partial liver transplantation. If you can just tell us real quick, I think a lot of people are familiar with living kidney donor programs, but there's also such a thing as living partial liver donation programs. The liver, it's an amazing organ.
Correct. Yeah, the liver is remarkable in that it has the ability to regenerate itself. So that's given surgeons such as myself the ability to perform resections, for example, for cancer, and and leave only a small portion of the liver behind, because we know that liver will regenerate over time and provide enough liver for that recipient or for that patient to survive. So we've taken that from a transplant standpoint and helped increase our ability to use organ donation for patients awaiting livers on the liver transplant wait list. So we can take, historically, it's been a small portion of an adult liver to a child, for example, a mom or a dad trying to help their infant who had congenital liver disease. But now we've extended that to adults, where a healthy adult can donate a portion, typically the right lobe of the liver, for another adult. You have to have a size large enough for that recipient, but also leave behind enough liver for the donor to survive.
Dr. White, that's incredible. With just a few seconds left, final words, can you tell us how important it is for people to get on the donor list?
Well, we certainly encourage, and this is certainly the month to do it, anyone to become an organ donor. Don't worry about your medical conditions. That's for us to sort out if the organs are going to be usable, and that can be done through your DMV, through social media. There's numerous avenues to be an organ donor and potentially save another life.
It's wonderful. Dr. White, thank you so much for joining us.
Absolutely. Thanks for having me.
Back after this.